Hey everyone, I am Prakhar Arora from CMC Ludhiana. My topic is to determine the prevalence of refractive errors in undergraduate students of Christian Medical College, Ludhiana. Introduction. Refractive error is a term used to describe a condition when incident parallel light beams are unable to focus on the light-sensitive layer of the retina. The following are the most common types of refractive errors: myopia, hypermetropia, astigmatism. Importance of detection of refractive errors. It is the most prevalent condition that affects people of all ages and is the second most common cause of avoidable visual impairment, accounting for 43% of all visual impairments globally. According to estimates from the WHO, 19 million young adults suffer from vision impairment. Undetected refractive problems can lead to ocular discomfort, attention deficit, avoidance of work, and the formation of a negative link between visual discomfort and educational activities. Therefore, we conducted a study to determine the prevalence of refractive errors in undergraduate students of CMC Ludhiana. My aim was to determine the prevalence of refractive errors, material and methods. This was a cross-sectional study conducted in the Department of Ophthalmology, Christian Medical College Ludhiana. A total of 300 undergraduate students were enrolled and studied over a period of 3 months. A detailed history and examination of each student was done. Diffraction was done for each student with visual acuity less than 6/6 and error correction was provided individually. Further, types of refractive errors were recorded and categorized according to the dioptric powers. Results and analysis. Among the 600 eyes examined, the prevalence of refractive errors was found in 369 eyes, accounting for 61.5%. The most common refractive error was compound myopic astigmatism, seen in 168 eyes. Among 76 male students and 224 female students, prevalence of refractive error was 60.5 and 61.8 respectively. The prevalence of refractive error was found to be the highest in the age group of 18 to 20 years. Compound myopic astigmatism was the most prevalent condition, affecting 119 female eyes compared to 49 male eyes. Similarly, simple myopia was observed in 113 female eyes versus 33 in males, and simple myopic astigmatism was seen in 36 female eyes compared to just 6 male eyes. Less frequent conditions such as hypermetropia and other astigmatisms displayed minimal gender variation. Notably, among the 231 eyes with no refractive error, female again outnumbered the male significantly. Compound myopic astigmatism was the most common, affecting 168 eyes, mainly among 18 to 20-year-olds and 21 to 23-year-olds. Simple myopia ranked second, impacting 146 eyes, with the highest prevalence in the 18 to 20 age group and under 18s. Simple myopic astigmatism was affected 42 eyes primarily in the 21 to 23 and 18 to 20 age ranges. Less frequent conditions include hypermetropia, while 231 eyes showed no refractive error, especially among 21 to 23-year-olds. Discussion. The age-wise analysis underscores the burden of refractive errors among younger individuals, particularly those aged 18 to 23 years. The age group exhibited the highest prevalence of compound myopic astigmatism, simple myopia, conditions often associated with extended near work such as reading, studying, and prolonged use of digital devices. The current study also highlighted the predominance of myopic conditions, with compound myopic astigmatism observed in 28% and simple myopia in 24.3%. Interestingly, the prevalence of myopia and astigmatism in this age group aligns with the global trend of rising myopia in younger populations. The low occurrence of hypermetropic conditions is consistent with their lower prevalence in the general population. These conditions are less common. Their presence across diverse age groups emphasizes the importance of comprehensive eye examinations to identify less frequent but clinically significant refractive errors. Conclusion. The findings emphasize the significant burden of myopia and astigmatism among younger population. These trends highlight the need for focused public health strategies, including awareness campaigns about risk factors, preventive measures, and the importance of regular eye checkups. However, more similar studies across diverse populations and settings are essential to provide a deeper understanding, identify underlying causes, and develop targeted interventions for effective management and prevention of refractive errors globally. These are my references. Thank you.
Thank you. Couple of things actually. Did females outnumber your subjects? You said female eyes had more refractive.
So we included like BSc nursing and all the nursing staff also. So the females were in a higher number. So
out of the 600 eyes you are saying?
Yes, sir. The 224 were females and 76 were males.
So naturally the females will outnumber,
yes,
no? And the other thing I just wanted to know was, what was the inter-eye correlation? Like Was there any difference between the refractive error between two eyes of
Yes.
the same person?
Yes, so there was difference. So we studied like
Did we
eyes,
study
not
those?
like students. Like
Did we
stu-
study that? No.
Yes, sir. So we studied like if there are 300 patients, it will be 600 eyes. We studied each eye individually for each refractive error.
No, but what sir means is, did you compare the right to the left and find that rights were always more than left?
Is there any
No, sir.
anisometropia or no?
No, so we did not.
You did not study, or you?
So we just analyzed which refractive error is present in each eye, not compared the right to the left one.
Would you do a follow-up of these?
We can.
Because,
We can.
No, but the reason, you should tell the reason why sir is asking this, because one of my questions was, did you grade them according to the year of course?
yeah,
And why are we
because
asking
they are
the same
still in the
question?
growing age group, so they might be developing myopia or refractive error. So if you study them after say 2 years or 3 years, and were they all using correction?
Not everyone, sir, but majority of them, yes.
Have you taken any family history? Is there any relation with the family history?
No, sir, we did not take any family history.
And the incidence of high myopia or pathological myopia?
No, we just compared.
You didn't do fundus?
No, sir.
You may have the correction still also, but once you want to publish the paper, you need to write all those things, as sir has suggested. Also, how many people were prescribed new glasses?
Okay.
That is a very important point which sir has raised. You need to add that to your study.
So beyond what astigmatism did you take it as compound?
Ma'am,
Even 0.2,
Yes, ma'am.
0.1, any amount?
any amount.
By what? By
Any amount.
by retinoscopy or automated?
Automated refractive.
So only automated was
Yes,
done
ma'am.
for these patients? No
Yes, ma'am.
subjective
No.
testing was done?
Subjective testing was also done for each patient.
And these are only only BSc nursing or also
And
MBBS?
MBBS also, all undergraduates.
Did you classify them as per the year? Did first years have less and then fifth,
No,
the
ma'am.
final years have more?
Age or
because-
And we
something?
classified according to the age because across they all are different age groups.
So why would it have been more interesting had you given us year-wise categorization? The reason, why would it have been more interesting?
Yeah, I think instead of eyes, if you would have taken patients or subjects and categorized them according to the age, that might have given a more significance to the study.
Also, what would be the confounding factor in this study?
Ma'am,
A very significant confounding factors in today's medical students, which may be slightly less in the nursing student. And that is, I think, screen time.
yes.
Because mostly medical students these days are moving with the iPad, at least in our college. I don't know about you all, but
I think it's everywhere.
so how much of extra screen time do they have in addition to studies? Do they study fully on the screen or on books? All these things might have some role. Thank you.